Every 40 seconds, somewhere in the world, a person has a stroke. By the time you finish reading this first sentence, someone's brain has just been hit. Stroke is the second leading cause of death on this planet. It is the single most common reason people end up with a permanent disability, unable to speak, unable to walk, unable to recognize the faces of the people they love. And every year, it takes nearly 6 million lives. But here is the part that most people are never told clearly enough. In a very large number of cases, not all, but a very large number, the brain gives you a warning. A specific, readable, unmistakable warning. Hours before, sometimes days before. The kind of warning that, if you recognize it and act on it, changes everything. The problem is nobody ever sat down and explained what that warning actually looks like. Until today. My name is Dr. Caldwell. I have been practicing internal medicine for close to 30 years. And I want to tell you something I tell every patient who sits across from me when we talk about stroke. This disease is not a lightning bolt from a clear sky. In most cases, it is the predictable endpoint of a process that has been building for years, and it almost always announces itself before the main event. If you know what the announcement looks like, you still have time to act. Stay with me through this entire video, because near the end, I am going to walk you through 3 specific tests you should ask your doctor about, tests that can show right now how much risk you are actually carrying. And one of them catches a danger that is completely invisible, comes and goes without any symptoms, and is responsible for some of the most severe strokes we see. You need to know about it. But first, let me tell you about a patient I will call Raymond. Raymond was 72 years old, retired contractor, strong, practical man, the kind who fixed things himself rather than calling anyone. He came to see me for a regular checkup, feeling perfectly fine. At the end of the appointment, almost as an afterthought, he mentioned something that had happened about a week earlier. He had been in the kitchen making coffee when one eye suddenly went dark. Not blurry dark, like a curtain pulled down over it. He blinked a few times, and within about a minute, his vision came back completely. He had told himself he stood up too fast. He had not mentioned it until now, because he felt completely normal and did not want to make a fuss. He had also noticed, the previous month, a brief episode where the right side of his face felt strange numb, like it had been at the dentist for about 10 minutes. Then it went away. I referred Raymond for urgent evaluation that same afternoon. The imaging showed a carotid artery narrowed by more than 70% from years of plaque buildup. He was days away from a major stroke. He had surgery within the week. He recovered fully. He still comes in for his annual checkups, and he always makes a point of saying the same thing. I almost didn't mention it. That sentence is the reason I am making this video. To understand why the warning signs matter so deeply, you need to understand what is actually happening inside the brain during a stroke and why time is the most important factor in the entire equation. Your brain weighs roughly 1.4 kilograms. That is about 2% of your total body weight. And yet it consumes approximately 20% of all the oxygen you breathe and 25% of all the glucose circulating in your blood. It is the most metabolically demanding organ in the body, and it runs continuously, every second of your life, without rest. Cut the blood supply to any part of that brain, even for 4 to 6 minutes, and the cells in that region begin to die in ways that cannot be reversed. That is what a stroke is, a blood supply cut off. And that is why doctors say stroke is a race against time. It is literally a race to restore blood flow before the damage becomes permanent. Now here is what most people do not realize about how that blood supply gets cut. For the most common type of stroke, called an ischemic stroke, which accounts for about 85% of all cases, the vessel does not simply rupture or collapse without warning. The groundwork was laid years earlier. The walls of the artery were gradually damaged. Cholesterol and inflammatory deposits built up. The opening slowly narrowed. And then, at the end of that long process, a clot forms or a fragment of plaque breaks loose and the vessel is blocked. That process is not invisible. Your body sends warning signals as it happens. And those signals have a name in medicine. They are called transient ischemic attacks, or TIAs. Transient means temporary. The episode comes and then it goes. The vessel spasms briefly. Blood flow stops for a short time and then it returns. The symptom fades. and most people believe they are fine. What the research consistently shows is that a transient ischemic attack very often precedes a major stroke, typically within the following 72 hours. 3 days. That is the window. That is the time when intervention can still prevent the catastrophe. Most people do not use that window because the warning was brief, strange, and disappeared. So they talk themselves out of it. I want to make sure you never do that. Let me walk you through the 5 warning signs clearly, specifically, with exactly enough detail that you will recognize them if they happen. The first warning sign is one of the most dramatic, and also one of the most consistently dismissed. Sudden temporary blindness in one eye. You are walking through your house, or sitting at the table, or getting out of the car, and suddenly, without any buildup, without any pain, one eye goes dark. Not blurry, dark. Or perhaps a gray fog moves across the field of vision in that eye, like someone dragged a hand across a fogged window. It lasts anywhere from a few seconds to a minute, maybe 2. Then it clears completely and you can see normally again. Almost everyone who experiences this tells themselves the same thing. I stood up too fast. I was staring at the screen too long. I was tired. Let me explain what is actually happening. Your eye and your brain share the same blood supply. The artery that feeds the retina, the light-sensitive tissue at the back of your eye, is a direct branch of the carotid artery, which is the main artery running up through your neck to your brain. When a tiny clot or a small fragment of plaque breaks free from a narrowed section of that carotid artery and travels upward, it can lodge briefly in the artery, feeding the eye. Blood flow to the retina stops for a moment. You see darkness. Then the fragment shifts, blood flow returns, and your vision comes back. Think of it like a temporary blockage in a pipe. The water stops flowing for a moment. Then the obstruction moves, and the water flows again. Everything looks fine from the outside, but here is what makes this so serious. That same fragment could have traveled 2 millimeters to the side into a brain artery instead of the eye artery. And instead of 1 minute of darkness in one eye, you would be facing permanent loss of speech, paralysis on one side of your body, or worse. The eye blackout is a warning shot. Doctors treat it as a fire alarm. Neurologists have a term for it, amaurosis fugax, meaning fleeting blindness, and when a patient describes this symptom, it triggers urgent evaluation. Hospital records show a consistent pattern of patients who experienced 2 or 3 of these brief eye episodes and ignored them, and whose very next event was a full, devastating stroke in the brain. If this has happened to you even once, even months ago, please bring it to your doctor's attention immediately. Write it down before you forget the details. The second warning sign is one that feels so familiar, so ordinary, that almost everyone explains it away without a second thought. Sudden numbness or tingling on one side of the body. It might be the whole arm. It might be just the hand. It might be half of the face, the cheek, the lips, the tongue. Or it might be one full side of the body from the shoulder down. It feels like pins and needles, like cotton has been stuffed beneath the skin, like that limb has suddenly become someone else's. And it arrives out of nowhere while you are simply sitting, or talking, or doing nothing in particular. Then after a few minutes, it fades and everything feels normal again. Now we have all experienced a limb falling asleep. You sit in a particular position, you compress a nerve, and the result is that familiar pins and needles feeling. That is completely different from what I am describing. When a nerve is compressed, the numbness is related to position and resolves when you move. It has a clear mechanical cause. What I am describing has no cause you can point to. You were not sitting awkwardly. You were not putting pressure on anything. The numbness arrived on its own, affected one side of the body, and disappeared on its own. Here is why that distinction matters so deeply. The sensation from your right arm is processed in the left side of your brain. The sensation from your left arm is processed in the right side. When a region of the brain briefly loses blood flow, it stops processing the signals from the opposite side of the body. That is when you feel the numbness. And because it is one-sided, because it corresponds to exactly one hemisphere of the brain losing circulation, it is a neurological event, not a positional one. What most people don't realize is that this one detail, one-sided versus both-sided, tells you almost everything about the cause. When both hands go numb at the same time, that usually points to something in the neck or spine. When just one side of the body suddenly goes numb without any positional cause, That is a strong signal to be evaluated for a vascular event in the brain. If this has happened to you, even briefly, even once, do not file it away as nothing. Mention it at your next appointment. I want to pause here for a moment. If you have experienced either of these first two signs, or if you are watching this because someone you love has, I want you to go to the comments right now and type the word aware. Just that. It tells me this information is reaching the people who need it, and it helps this video find more of them. And if this kind of clear, plain language health information is what you have been looking for, a thumbs up takes 1 second, and it means a great deal. The third warning sign is one that people almost always attribute to something completely unrelated. A sudden loss of coordination. A drunk walk without any alcohol. You are walking across a familiar floor, a floor you have crossed thousands of times, and suddenly your foot lands in the wrong place. Your leg feels rubbery, unreliable. You veer sideways and reach for the wall. Or you are struck by a violent spinning sensation, not because you moved quickly, not because you stood up fast, not because of any obvious trigger and you have to grab a door frame to steady yourself. Most people who experience this blame bad shoes, fatigue, low blood pressure, or the idea that they simply moved too fast. And sometimes those explanations are correct. But here is the distinction that matters. Dizziness that has a clear, consistent trigger rolling over in bed, turning the head in a specific direction, a known inner ear condition that is a different story from dizziness that strikes without warning while you are upright and moving normally. The part of your brain responsible for balance and smooth movement is called the cerebellum. It sits at the back of your skull, just above where your neck meets your head. Its job is to continuously calculate where your body is in space, measuring every movement, every shift in weight, every step, and to coordinate the precise firing of muscles so that you walk straight, reach accurately, and stay balanced without consciously thinking about it. The cerebellum receives its blood supply from arteries that travel upward through the bones of the neck into the back of the skull. When blood flow through those arteries drops suddenly, even for a few seconds, the cerebellum essentially loses its signal. It cannot do its calculations, and the result is that your body loses its coordination without warning. You stagger, you spin, you reach for something to hold. Think of it like a GPS that suddenly loses satellite connection. While the signal is gone, it cannot tell you where you are or how to get where you are going. The moment the signal returns, the map reappears. But for those few seconds, you are completely disoriented. That is what a transient loss of cerebellar blood flow feels like from the inside. If you have experienced sudden, unprovoked dizziness combined with any difficulty walking straight, treat that combination as a possible warning sign and bring it to your doctor. The fourth warning sign moves us into territory that is genuinely frightening because it involves your ability to communicate. A sudden problem with speech, words that will not come out, or words that come out wrong. Stay with me because this part matters, and I want to be precise about what I am and am not describing. Forgetting a word when you are tired. Searching for a name that is on the tip of your tongue, momentarily losing the word for something familiar. These are normal. They happen more with age, with fatigue, with distraction. They are not stroke signs. What I am describing is different in a way that is immediately obvious even to the person experiencing it. There are two primary speech areas in the brain, both typically located in the left hemisphere. The first helps you form words and send instructions to the muscles of your mouth, tongue, and lips. When that area loses blood flow, even briefly, you may understand everything being said to you. You know exactly what you want to say. But when you try to say it, the words come out slurred, fragmented, or stuck. It feels as though the connection between the thought and the words has been cut. The second area handles the comprehension and organization of language. When it is affected, a person may speak fluently, but produce sentences that make no sense word salad, as neurologists call it, and may struggle to understand what others are saying to them. Both types of speech difficulty, if they appear suddenly and then resolve after a few minutes, are classic patterns for a transient ischemic attack. Not tiredness, not stress, not a bad night's sleep, a brain territory briefly losing its blood supply. Think of it this way. Imagine trying to make a phone call when the signal drops. The call connects, but the voice breaks up, drops words, becomes incomprehensible. Then the signal returns, and the call is clear again. The phone is fine, the voice is fine. The problem was the connection, and the connection here is the blood supply to the language center of your brain. When speech breaks down suddenly, even for a few minutes, even if it completely resolves, that is not something to sleep on and mention eventually. That is something to mention to a doctor urgently. The fifth warning sign is the one that surprises people most because on the surface, it does not look like anything to do with the brain at all. A combination of a skin condition called vitiligo with new, unusually strong headaches that do not fit your normal pattern. Vitiligo is a condition where patches of skin lose their pigment areas of pale or completely white skin that appear because the cells responsible for producing color have stopped functioning. Most people who have vitiligo think of it as purely a cosmetic condition, and in many cases, it causes no medical complications at all. But here is what most people do not realize. Vitiligo is an autoimmune process. It means the immune system has begun attacking the body's own cells, in this case, the pigment-producing cells in the skin. And when the immune system goes off target in that way, it frequently does not stop at one tissue. In a significant number of people with vitiligo, that same underlying autoimmune process quietly inflames the inner lining of blood vessels throughout the body. That lining, called the endothelium, is a microscopically thin layer of cells that coats the inside of every artery. When it is healthy, blood flows smoothly over it and nothing sticks. When it becomes inflamed and damaged, the surface roughens, and on a rough surface, cholesterol, platelets, and inflammatory proteins begin to accumulate, forming the seeds of the plaques that gradually narrow and stiffen arteries over time. Vitiligo alone is not a sentence. Many people with vitiligo never develop vascular problems. But vitiligo, combined with new headaches that are different in character from your usual ones, headaches that come on stronger, last longer, feel unlike anything you have experienced before, is a combination that deserves proper vascular evaluation rather than simply waiting to see what happens. And this is where things become dangerous for people who take new headaches at face value, because headaches have many causes, and not all of them are vascular. A very common source of chronic head pain in older adults is arthritis in the small joints of the upper neck wear and tear that irritates nearby nerves and sends pain upward into the head. This has nothing to do with the blood vessels feeding the brain. Another common contributor is an undiagnosed disc problem in the neck, which can send referred pain up into the skull. The point is not to panic over every headache. The point is this: if you have vitiligo and you develop headaches that feel new, that feel different, that feel stronger, tell your doctor both things together. Let them evaluate the combination. Now, I want to talk about what is actually damaging your blood vessels over the long term, because understanding this changes how you think about prevention. The most important thing to understand is this: blood vessel damage is not only about cholesterol levels. It begins with the condition of that endothelial lining we discussed, the inner surface of every artery. When that surface is healthy and smooth, things flow past without sticking. When it is damaged, inflamed, and roughened, everything begins to accumulate. Two of the most powerful enemies of that lining are chronically elevated blood sugar and smoking. When blood sugar remains elevated for long periods, even mildly elevated, even at the level doctors call prediabetes, the endothelial cells that line your arteries are slowly starved and damaged. They lose their flexibility. They lose their ability to contract and relax with changes in blood pressure, and those damaged, roughened areas become landing pads for cholesterol and platelets. Plaque begins to form. The vessel narrows. This process begins years before anyone tells you that you have a blood sugar problem. That is why it matters to know your numbers early, not just once, but consistently, over time. Smoking is the second major assault. With every cigarette, dozens of toxic compounds hit the endothelial surface and cause direct chemical damage. At the same time, nicotine and carbon monoxide make the blood thicker and more prone to clotting. A damaged vessel wall plus thick, sticky blood is the precise combination that produces the clots that block brain arteries. Smokers carry roughly 2 to 4 times the stroke risk of non-smokers with the same cholesterol and blood pressure numbers. That gap is almost entirely driven by what smoking does to the endothelium. Blood pressure deserves its own moment here, because there is a common misunderstanding about how it connects to stroke. Most people know that chronically high blood pressure damages vessel walls and drives plaque formation. That is true. Uncontrolled hypertension is one of the strongest risk factors for stroke. But here is something most people are never told. An ischemic stroke often does not happen at the peak of blood pressure. It happens at a relative low point. Think of a carotid artery that is already narrowed by 60 or 70% from years of plaque buildup. It is like a water pipe with a severe constriction in the middle. As long as the water pressure in the system is high enough, some water still squeezes through the narrowed segment. But if the overall pressure drops, as happens naturally during sleep, when blood pressure falls by 15 to 20%, the flow through that already tight segment can fall to nearly zero, especially if a small clot has settled at the plaque site. That is why some people go to bed feeling perfectly well and wake up with a stroke, or why someone finds them that way in the morning. It does not mean low blood pressure is dangerous. It means a narrowed artery combined with the normal overnight drop in pressure can be the final sequence that produces a blockage. Let me now tell you about the 3 tests I promised at the beginning, the ones I want you to ask your doctor about, especially if you have experienced any of the warning signs we discussed. The first is a carotid duplex ultrasound. This is a specialized imaging test of the arteries in your neck. Unlike a basic ultrasound, this one shows both the physical structure of the artery and the pattern of blood flow through it, including whether the flow speeds up or becomes turbulent at a narrowed section, which is a sign that the narrowing is hemodynamically significant. If a carotid artery is narrowed by more than about 70%, the risk of stroke becomes very real, and surgery to clear that artery can prevent a devastating event. It is a proven, well-established procedure that saves tens of thousands of lives every year, but only if the narrowing is found. Ask your doctor whether a carotid ultrasound makes sense given your risk factors and symptoms. The second test is called glycated hemoglobin, or HbA1c. It is a blood test that reveals your average blood sugar level over the previous 3 months. Not just one fasting snapshot, an average, built up over time, that reflects what your blood sugar has been doing day in and day out. Because blood sugar causes its damage slowly, consistently, without any single obvious event, this test catches people in the dangerous gray zone, blood sugar elevated enough to injure the endothelium for months, but not yet high enough to have received a formal diagnosis of diabetes. That zone is called prediabetes, and it is where a great deal of silent vascular damage occurs. If you have not had this test in the past year, bring it up at your next appointment. The third test is a Holter monitor, a 24-hour heart rhythm recording. Instead of the brief snapshot of an ordinary ECG in a clinic, you wear a small recording device for a full day while going about your normal routine. The reason matters enormously. There is a heart rhythm condition called atrial fibrillation, or AFib, where the upper chambers of the heart lose their organized beat and begin to quiver chaotically instead. When this happens, blood does not empty smoothly from those chambers. It swirls and churns. And in churning blood, clots form easily. Those clots can travel directly from the heart up to the brain and lodge in a brain artery, causing what is called a cardioembolic stroke, which tends to be among the most severe. Here is what makes AFib so insidious. Many people who have it feel almost nothing. An occasional flutter, a brief sensation of skipped beats they blame on caffeine or stress. It comes and goes in episodes that a routine clinic ECG easily misses. A 24-hour Holter recording catches those episodes, and if AFib is found, there are well-established medications that can reduce the associated stroke risk by 60 to 70%. That is not an inevitable outcome. That is a risk that can be actively, meaningfully reduced if the condition is found. Before I close, I want to tell you something important about what to do if any of these warning signs occur, not at some future point, but if it happens to you or someone with you. Do not drive yourself to the hospital. A warning episode that affected your vision, your coordination, or your speech can return without warning and at highway speed that puts lives at risk. Arrange transportation or call emergency services. Do not take aspirin on your own initiative. I know this sounds counterintuitive. For years, the advice around emergency heart events has been to chew an aspirin. But stroke is not a single type of event. There are strokes caused by blockage and strokes caused by bleeding. Aspirin thins the blood, which can help in the first type and accelerate catastrophic harm in the second. Without brain imaging, no one can tell which type is happening from the outside. Let the medical team make that decision after they have the imaging they need. Position matters while waiting for help. Lying flat, with the legs slightly elevated, generally supports blood flow to the brain better than sitting fully upright. Keep the head in a neutral position, not bent sharply forward, not thrown back, so that the neck vessels are not kinked or compressed. And when you do get to a doctor after a warning episode, or when you are discussing stroke risk, bring a written list of every medication you take. In a crisis, those precious minutes spent reconstructing your medication history from memory can make a genuine difference to the treatment decisions made in the first hour. If 72 hours pass after a warning episode without a new event, please do not tell yourself the danger has passed. The window for intervention is still open. The evaluation is still urgent. A transient warning that resolved completely is not your body saying it is fine. It is your body saying it gave you another chance. Use it. I want to leave you with something I have carried with me throughout 30 years of sitting across from patients. Stroke is not random. It is not inevitable. It is not something that simply happens to some people and not others without cause or pattern. In the overwhelming majority of cases, it arrives at the end of a long, readable story, a story written in blood pressure numbers, blood sugar levels, narrowing arteries, and warning episodes that came and went without being recognized. You now know how to read that story. You know the 5 warning signs, the curtain over one eye, the sudden numbness on one side of the body, the drunk walk with no alcohol, the sudden breakdown in speech, the combination of vitiligo and new headaches. Any of these, appearing for the first time and then resolving, is a reason to speak to a doctor urgently, not eventually. And you know the 3 tests to ask about. The carotid ultrasound, the HbA1c, the Holter monitor. These 3 evaluations, taken together, can tell you and your doctor exactly where your vascular risk actually stands, not in general terms, but specifically with numbers you can act on. Raymond still comes to see me every year. He walks in on his own 2 feet. He shakes my hand, sits down in the chair across from me, and we go through his numbers together. And every time, before he leaves, he says the same thing. I almost didn't mention it. I think about all the people who did not mention it, who told themselves it was nothing, that it had resolved, that they would bring it up at some point. You are not going to be one of those people, because now you know what to look for. If this video gave you something real, something that will change how you think about the next time something unusual happens in your body, please share it. Send it to someone in your family. Put it where the people you love will find it. The person who recognizes a warning sign because they once watched a video like this one is the person who makes the phone call at the right moment. And if you want to keep receiving information like this clear, honest, medically grounded conversations about the health issues that matter most for adults over 60, subscribe to this channel. Every week, I bring you something real, something you can use, something I wish more of my patients had known earlier. Leave a comment before you go. Tell me whether you or someone you know has experienced any of these warning signs. Tell me which one surprised you the most. I read every comment, and what you share guides what I bring to you next. I am Dr. Caldwell. Thank you for being here. Thank you for taking your health seriously enough to watch something like this through to the end. Please take care of yourself, and please speak up when your body does. I will see you in the next one.